Nice evening, ladies and gentlemen. I'm very happy that the people before of me told us such a lot of things about the scanner. What I want to present you is a special technique what I developed in Switzerland. I come from Switzerland, and I'm doctor of biological medicine, but I work as natural doctor because I have a little bit the same experiences like Jörg. And yeah, my colleagues from the medicine tells me that I'm becoming a witch. So I think a witch is nothing negative. And yeah, I think it's something special. And therefore I called my technique also magic gloves. And I have to work a little bit quicker. I'm Swiss, so I will be very precise, half an hour. And I think we are a little bit too late, so okay, let us push it. So the reason for development of this method was that I wanted to feel. I wanted to feel what I do with my hands. And not only have a look with the normal technique after Ravenko. And when I was on the master seminary, I told him, oh, that's great what you do, but sorry, I can't do that. And he told me, работайте како хотите, but work. The only contradiction is if you have your scanner in the pocket. So I was very glad about it. The German scanner group was not so happy about it. The Swiss no more. But yeah. What was for me the most important thing is that I can give this impulse, this scanner impulse, to the people also directly after my opinion with my hands. The gloves, yeah, okay. I can feel the tension when I treat my patients because I feel how the muscles work. And you can really treat the whole body nearly. And what's also interesting, you can treat the muscle chains. If somebody knows how they are working, that's really great. You can read it at home, so I will be a little bit quicker. Is it okay? That's what I told you with the trigger points. What was also a very important thing, that if you are treating trigger points normal with your hands, after 4 patients you are nearly crashed down, yeah, because it needs such a lot of power, and yeah, it's emotionally also for the therapist very heavy. So I thought there must be another possibility to treat soft and nearly without pain. Sometimes it's necessary to have a little bit pain, and I must say I have some patients who told me, oh, make it, oh, that's so great. Oh, God, what you told me it's great, and I think you have pain. And he told me, yeah, but it's a good pain. Okay, then it's okay for me. That the blood circulation of the tissue is stimulated, that you can also see. Because if the people came to me, yeah, I came from this page of the natural medicine, no, of the medicine part. So everywhere they are telling us, you have to have a study. I know how the study was made. So, and I think the most of you know it also. Yeah, if I don't know the study myself, I don't believe it. But if you see that the patient in front of you is absolutely white colored, there is nothing, no blood, and you treat him and it seems like, oh, he's fresh. And he feels also fresh. So you see that something happened. You have also reported about it. Yeah? So I think sometimes it's not so necessary to have clinical research, because how I told you, if there are studies from Russia in Switzerland, the doctors will tell you, these are only Russian studies. If I tell them, okay, NASA have treated it, and they could show that there has power on bone and muscles, they say, yeah, that's American, you know. And if it will be made in Switzerland, they will say, yeah, I don't know the doctor. So, yeah. Okay, less or more, the patient has less or more no pain if you treat him like that. You and he has to be in a really relaxed position. That's also for me very important, that the therapist is also in a relaxed position, that you don't treat like that and, ooh, my 3 lines. Because it's very, for me it was so stressing, this 3 lines, to make it absolutely right. You have to notice this, then you go, write it down, and sometimes I was, oh God, I can't do that. So, the therapy is normally very quick, because I have only 1 hour per patient, not more, in Switzerland. It's really, I can say, a very fast success. And the most patients after treatment feel very good, flexible, and they tell me they are reborn. Okay, they are their own feeling. Application, you can use it on all muscle tensions. We spoke about it. I don't think that it's necessary that I show it now, because you can really use Scenar everywhere. Here is only something special, the technique what I use, because I think a lot of you will be shocked or surprised. Yeah, we will see. Negative experiences. I have had also negative experiences because some people don't like electrical impulse. And I have had also some women's too, which have had a lot of pain. It was such a rheuma pain after the doctor, after the diagnosis. And I treat her, he comes to me like that, I can't work, you know, and don't touch me too much. Somebody told me that you have a fantastic machine. Okay. After the treatment, she told me, I have pain, but I can move. Okay. That was for her something great, because she couldn't move really. The fingers were like that, and she told me, I can't even write a letter. I can't even write my address. So please do it for me. And I have not an elevator. I am on the first floor, so it was a little bit difficult for her to come on. But yeah, she goes downstairs like that. So that I was not satisfied. I thought it's not enough what I have done for her, but she was satisfied. Okay. So what? Yeah, she can now every month, 1 time. She tells me always, isn't it possible that you take this pain away? I'm not such a good witch, okay? So I must learn a little bit more. Because many toxins from the, that's very important. And I think that must be told everywhere and to every client. Please drink enough water. Coffee is not water, tea is not water, orange juice is not water. Really, drink enough water if you were treated with the Scenar, because that brings a lot of toxins out. And these toxins must go to the liver. And there they have to be sometimes twice, sometimes 20 times, sometimes 15 years, always a little bit cracked. Yeah? And if you have people which eats every day about 6 blood pressure medications, so I ask how can they live? And if they tell you they have vertigo, sometimes, yeah, I must say, have you, no, okay, are you analphabets? Yeah, because everything is written in the package of these medicaments. Yeah, and if the doctors give it to a client, I must say, where is the study? Yeah, because there is no study that you can mix such a lot of medicaments. And if I have patients with problems of anxious and so on, psychical problems, and they have a dopamine blocker and a dopamine receptor blocker. Huh? For what? If the dopamine is blocked, so why something more for block it inside of the receptor? Yeah? This, okay. But for that, the doctors have, yeah, the possibility. So what you need for that is devices. That can be also the home. Absolutely easy home. And you put it on. You need gloves. Vinyl gloves is better because they are slightly smooth. And you need the gloves wet. Yes? Pardon? Oh, enough wet. Really, really wet. Okay? They will become. So you need the Scenar devices, vinyl gloves, 2 slightly wet tissue gloves, cable, normally I have to look at my patient and have a look how he walks or how she walks, how is the behavior, if they are walking like that or normal. So you see a lot. You see how it pronounces his walking, his behavior. Then you can also ask the people, what do you have for problems? And sometimes you see he's walking like the knee has problems and the basin has problems. But he told you, yeah, my shoulder. Okay, I accepted it, and I tell them times before I told them, but your knee, you have no problems with. No, my shoulder. Okay. Now I don't talk too much because sometimes the people are not so happy if they have to tell me too much in the first session. So, okay, I look at them, I ask them what they tell me, what they don't tell me, they don't tell me. I will see it later or hear it later. Okay? So, I will show you today the problem example back pain. So you put it here inside. And what's important to know about the back pain, you have there the lumbar spine. This is reflectory for the neck. And very often people with problems here, I have time before treated always here. I didn't do that, no more, because I couldn't really stop it. So I started with this region. And what's really interesting, the sacroiliac joint is really a holy joint. It's really one of the most important places on the body. And it's funny that Sasha Ravenko is not so much interested in that area. Yeah? He more works somewhere else. So please don't be so shocked that I work with this area. Okay, you have seen it, pelvic girdle. That's a very important thing because you have a lot of muscles inside. You have here, you have upper. For example, if you have a problem with the shoulder, frozen shoulder, treat please always this back and then latissimus dorsi, because this is very often that point which is not treated. Everybody treats here, but yeah, that will be often forgotten. Yeah, here, oops, here it is. Yeah, here it is what I normally use. Yeah, normally. Because the most people have, okay, I don't use it like that. So it will be not so comfortable for the therapist now, okay? You have pain or not? Okay. This is the intensity, and I ask always the patients, what do you like? The most of them say 7, 4, 6. The Russian always 8. But yeah, okay, so. You know how you work with the scanner? Okay. You have to feel it right.
Okay.
Yeah, that is, no, only this. Yes, okay. I always look how it works, if it works well. And then I put it like a flying bird on the back. You feel it? Okay. And then I stay there. I stay there till I feel that it moves a little bit. Yeah? And yeah, it moves because I try that the muscles works, so it moves under your hands. You will see it later. Yeah? You will see it really. Really. Can you come a little bit back? And no. In the front. Yeah. Stride on. Yeah. Is it too strong for you? Okay. If you need more, you can regulate it yourself. Because normal and never contact right and left, so you have not feel it. Okay. Nearly everybody wants that after some half a minute that it's stronger. They like it. Okay.
I've got this on 108.
108. Yeah, because
the power level is.
It's on 1:1, SC1, 16, intensity 6.
I think that it's chronic or maybe fresh, so that's why I took this 16. Is it okay?
8.
So I move now a little bit higher. It's too much. You feel it? Movement?
Always problematic with being a bit British.
Bitte? Ich tue nur Hände auflegen. I put only the hands on. No. I do nothing. I let work the patient. I come up with. Yeah, it depends. I always want to feel if it becomes softer, yeah, under my hands and work something. And I'm under the coaster. No, you don't make no like that, okay? Sorry? See it? Okay? Works now. Yeah.
Are you moving the body or is the body?
No. I push, and she pushes again. You see, it's only one side which works, the other works. And if you have a problem that something is too contracted, another part must be too long. Yeah, normally it's the other part which is too long, this which makes pain. Not only the contracted. Sorry? Okay, sorry. Yeah.
So what's he doing now? You're pushing?
I catch you now. Yeah? Because if I have to do like that, it will be too much force for me. I need too much power, so I make it like that. Okay? Then patients told me, oh, that's my fat, that's my fat. No, that's not the fat, that's on the skin. Okay?
Go left hand.
You sit on one side.
Right side is working more than the other.
This is like Reiki with the Scenar glove.
You always, the patches, please make it like that it's under, yeah? It's because normally they click off and then it doesn't work. I have now a little problem because you have to sit now on my hand.
You want to do that?
Yeah, you just put it a little bit higher, and or somebody else.
I don't care. You want to like up there?
Yeah. That's nothing to love. That's great. Yeah, sit down.
Can you have somebody lay down on the table?
Yeah, but the first what I do is this treatment in sitting. Yeah, then they lie how it is necessary or how they can, because a lot of people can't lie on the ventral side. Yeah, if they are old, they can't. They fall me down. You see it? The movement, yeah. I'm not on the right position, yeah? Okay. Yeah. So, it's okay. You can stand up. I think it's okay. Yeah. Hä? Na sicher. I make it with the women's, with the men's, it's the same. Naturally, in my office, I have not such a lot of people there, right? Okay, for looking. So the people have not problems with it. You can ask Tamara, you can ask Oksana. So yeah, it works. How do you feel? Okay. Naturally, you can make it on the whole body. Yeah, and normally I make it full treatment, but I have only half an hour. So yeah, I think I'm in time.
How would you do the neck? You like just grab with two hands?
Okay, you must have a look if we have time somewhere to put it in, and I do it. Okay, you have to put this T-shirt off. Sorry. Yeah. Yeah. Yeah.
Yes. At the beginning.
Yeah.
Yes.
You can explain how it was,
Yes.
how you feel it.
Yes. I look at this precision, yes, and it is very important to begin and to get dynamics of the complaints, yes, and doctor before the precision begin to ask patient what he feel, yes, 2 minutes, yes, and now tell me please what you feel before the precision, your condition.
I was a little bit stiff in my lower back, a little bit higher in my lower back, and now it's fine.
But the next, you feel pain, maybe, yes? And yes, you have maybe, sometimes you have 100%, maybe. Today, but now, how many percent you have? For before precision, 2%. It is very little.
Yeah, but she wanted.
Yes. And after this, what you feel? Do you feel difference in your condition now?
I feel different from where she's touched me down. That's why I said it'd be nice to have my neck. I feel like half of me is release, but the top half is...
Let's translate it. Somebody, give us переводчик. даже если она чувствует 2% начала, она чувствует разницу в этих 2% этой боли.
In American, most countries we rate the pain from 1 to 10. So it's much easier, so everyone can understand, all patient knows 1 to 10. So can you tell us how much 1 to 10, 0, no pain, 10, the worst pain in your
20%,
life?
maybe it is 20%, yes? Two. Yes, understand. And now from 2 to 1, the same?
Nothing, zero.
Nothing, 0.
Have somebody really problems with his back? Come on.
We want to see the neck.
Okay. I can show you that. Okay. The doctor wanna know somebody who has really problems. So you can also ask Tamara. Okay. But no, I need the lower back. Okay. Yeah. Sorry. It doesn't work out.
Again, tell us,
Yeah.
all us, what you feel now before the precision.
I always
You
have
compare.
pain. I always have pain in my sacrum, and it's probably about a 4 right now.
4.
Always.
4, yes. And it is located only in this place, and if you
Yeah, and I have
radiation
and I
in the
have
legs,
down,
yes.
down the legs. and-
Now you feel
Oh, always. I hurt my
in this,
sacrum.
in this, yes. And the same 4 and
too.
4 and feet same,
Yeah.
yes.
Oh, feet are almost
I
numb.
only wanted
But,
to show
if
the
you stand
procedure,
up, yes,
not
stand
to
up, please.
treat somebody for becoming better.
I will see how it is like on this side.
Yes.
Oh, so this is on
Yeah.
this. Where do we buy this?
You can ask Tamara. Yeah.
What was it you said about you had to have with the gloves, you had to be tucked in
Yeah.
like that?
They have always. Yes.
You have to wear these as well.
Yeah. That I don't treat myself.
Oh, right,
Okay.
yeah, then you can't feel
Yeah.
it, yeah.
Would you
Okay.
call out so everyone knows what we're doing?
I have only to show it, not to treat. Yeah. Yeah. Okay. So we have to finish, but I can treat you, but the other have to go. So. Okay. Please don't do that for your neck and for your back. Yeah. Please, like that. Okay. Absolutely relax. You don't help me. No thing. Yeah. I try to help you. Yeah. I know that's always the problem with the therapist. You can put then higher. What do you want for intention? What do you like for a number?
No, I don't care.
Oh, between 1 and 8.
Oh,
1?
6 is good.
Okay, 6 is good. Okay. No. It's okay. No, sit. Really relax. The most important thing is that the patient is relaxed or try to be relaxed.
Well, you try to relax in 100 people when watching in your butt. I'm sorry.
You have not pain. I have pain.
Explaining her, okay? So she volunteered. She knew what she was volunteering.
I thought I'd get my neck done.
You can put it higher if you think it needs, okay? Please, you have to feel it right. Not only a little bit, okay?
You go as high as you can, do you?
Yeah. Now I'm off iliosacral. She does normally not, but she's a therapist, so she can. Yeah. I normally start about. Normally not if the person is not too much blocked. I don't feel too much of the vibrations. Yeah. If they are blocked, really blocked, I must go high, and then I feel it. Yeah. If you have patients with no sensitivity in the feet, yeah, then you must go really high, sometimes 250, huh? And then I feel it. It's really. Is it okay?
Are you trying to separate?
Yeah,
press?
you must separate. And I try also a little bit to press, separate. Yeah. I normally work on a ball. I have a big ball to sit down, so that is for me comfortable, and then I can work.
Oh, she's on the ball.
No. But I have, yeah, it's not possible to show it here. Normally, the client is sitting on the bed, yeah? On my treating bed. And then I make it like that. Yeah, yeah.
So you can also do a facial massage.
Yeah, you can do. You can make lifting, you can make, you can treat tinnitus a little bit, because sometimes it's problem with the muscles around the ear. Yeah, 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 yeah. Yeah, okay, thank you very much. Well, okay, thank you. You feel it, right? Okay.
But you have to have both hands, right? So
Yeah.
getting the positive energy.
What's the power if you turn it up high?
If it's too much, you can make it lower. And I push, really. Huh?
So that feels like really strong.
I let her come back, but I push in yeah, enough great power, I push her. Because I have to be really on the skin. And now I go under the coaster. And she moves me, not I move her. Yeah?
So she's pushing back.
Yeah, the muscles are working. Yeah? So, sorry, I go now to the hip.
Do you feel it more over here?
Yeah, you can feel it in your stomach too.
Yeah.
And is it on 3 to 1? Is it on
I am on the gallbladder point now. Yeah?
but it's on 1 to 1, so it's on
Yeah. A little bit like gallbladder. Huh? So,
So you always
yeah,
do this method on
if
1
it's
to 1?
possible, you must, the undertrousers you put on. Yeah. And the rest you must put on. Yeah, okay. So I might now like that to my client, and you sit down. Sit down on my hands. Really, really don't. Yeah. No. Come back. You inside. Yeah. Okay. Is it too much? Okay. And you see what the patient do. You see it a little bit? She makes like that a little bit. Okay? Okay, come on. You can be a little bit straight on, not so straight on. Yeah. See, something. It's a little bit like whipping. If I would have you like the person for treatment, you would whip, yeah, because you are not chronic patient, so that works very clearly.
And intensity is 6, right?
Yeah. It's only on 16.
You know, feel the triceps, yeah, the triceps here, how it works. Okay.
How long do you normally do this?
Was? Ja, in der Praxis, ja. Die sitzen auf dem Bett, ja, auf dem Bett. Und dann legen sie sich entweder auf den Rücken oder auf den Bauch. Normalerweise auf den Bauch, wenn sie das können. Und dann kann ich die ganze Wirbelsäule behandeln. Okay?
In deiner Praxis machst du
Ja. Mhm. So. Ja. Okay. So. No. You are okay. So now I go from here two here. Yeah. Resistant, yeah, okay. You can use about 20 times these gloves. Then you have to put it out, yeah? Be careful with washing it. Never do that to the wash machine. Clean it only with water or with a cleanser for toilets because this is really so aggressive that it can't make you that some smelling things on it or soap or what I don't know, yeah? Because if it's not really clean, it smells because the silver makes a reaction, yeah? Okay?
So you can only use them 20 times? And then you have to
Yeah, okay, if you are careful, you can use it also more. Yeah? And you see how she whips. Yeah? That's not me.
So how do you wash them? Just water?
Yeah, water. That's really the scanner has impulse. And you sometimes, very often you see that the edemas on the back are disappeared or nearly disappeared. Huh? And I don't know too much.
You actually added an additional circuitry of feedback with your hands.
Do you always use one-to-one?
Now she is in a good position, isn't it? How do you feel? Huh?
Don't ever stop.
Okay. And that's very important that the client has now a good position of the back, yeah? That it's really an angle which is right, not like that. Yeah? So, sorry. If it's too strong, you can regulate it, okay?
So on the top you don't go like this. On the top you go like this.
Yeah. What's funny, you can treat even horses like that. I have treated some horses, 4 horses, 5 horses, and they liked it. That you must make them only wet, and then with the old gloves, I treated them. And the first one I thought, oh God. After 2 minutes, he was so relaxed that he let his head fall really down. And I thought, oh God, he will fall down on me. Because, yeah, I drive horses, but I never saw something like that. And what was really very interesting, that they show me what they want from me. Yeah, they show me that where they want to be treated. Even the dog, what I have treated, like that. Normally I treat them with the Scenar. But it was really funny. The horses, that were 4 horses which were very late sterilized. So that was, I think, the most important thing for them, that I treat the scarf. But they were treated 2 times per year by a chiropractor and by a specialist for therapy, energetical therapy. And they wanted that from me. Yeah? And the client told me later, hey, you must come back because we don't need no more something. They are still now great, but I think it would be necessary. And what was also funny, the horse is the first what I treated. The other one wanted to see what I do, and he pushed always. And I thought, yeah, they will be afraid of it. No, absolutely not. No, a little bit else. Okay. Or, yeah, you must ask Yuri, and we make a seminar about it. So, can you make it lower? Ah, yeah, sorry. Come on.
Do you signify the difference between positive and negative electrodes?
No.
You don't.
I'm a witch. I don't need it. I'm a witch. I don't need it. No, really not. Yeah. Okay. So. Yeah. Okay. So we have to finish the procedure. You can ask the lady how it feels, and yeah. Ja. So schlimm ist es nicht. Wir sind Therapisten. Thank you.